Today we're having our 23rd annual Shots for Tots conference. It's a conference that we seek to educate our vaccine providers so that they can increase their rates of vaccination. That's important because immunizations save lives. So it's important to make sure that all children are fully vaccinated from until at 2 years of age.
And are immunizations safe?
Yes, immunizations are very safe. There's a lot of misconceptions about immunizations and adverse effects, but overall vaccines are really safe and protect way more lives.
Why do you think that there's this misconception?
Well, unfortunately, there was a paper that was discredited that was out that linked the measles, mumps, rubella vaccine to autism. And because of that paper, even though it's been discredited, there still are a lot of people who believe that vaccines can cause that disease.
My talk was on how different ways we can use technology to promote vaccination.
And what are some of those ways?
So we found that using text messaging is a good way of providing vaccine reminders for parents, and both reminding them to come in for vaccination but also to give them educational information about vaccination. Also, electronic health record alerts in the EHR for providers helps them to not miss opportunities to vaccinate. And in addition, data exchange between immunization registries, state registries, and healthcare providers is a good way of making sure that at point of care, clinicians have all the vaccination data they need for their patients.
Why exactly should children be immunized?
So vaccination is probably one of the most important things that we can do for children to really protect them against these vaccine-preventable diseases that unfortunately are still out there. It was readily apparent during the measles outbreak and the Disneyland outbreak last year. We also have a number of pertussis outbreaks nationally as well. And really the single most important way to protect children from these diseases is to vaccinate them.
It's truly important to have the children immunized in order to prevent them from being sick of all these preventable diseases. These diseases, although we don't see them that often nowadays, they still exist and they cause severe consequences to the child that becomes ill, whether for chicken pox or mumps or measles or pertussis, whooping cough. So why shouldn't you not take the preventive steps of vaccinating your child to ensure that that child doesn't have to suffer the illnesses that this vaccine provide immunity to? And not only that, there is a cost associated whenever you're sick. So it's a cost saving to the parents to be able to get the child protected against all these childhood diseases.
What are some of the reasons that parents aren't getting their children protected?
I think it's lack of knowledge. I think sometimes they're well intended to get the children immunized, but they may not see the value of it, and they procrastinate the immunization provision at the pediatrician's office or the healthcare provider's office. So I think a lot of it has to deal with the fact that people tend to forget the fact that these are drastic illnesses and they don't put the strong value on vaccination as they should.
What are some ways that we can correct this issue?
One other thing is by education. I think the healthcare providers can play an important role in motivating, informing, and educating the parents about the importance of vaccination. Reminder recall serves to remind parents that children need to be vaccinated on a timely basis. So I think most important is definitely the provider motivation to the parents in getting the child immunized. That's extremely important because the parents believe in what the healthcare provider says. So that's to me one of the major factors on it.
These conferences, what is the importance to the healthcare community?
Well, the importance is it brings all the healthcare providers or people whose interests are immunization or preventive health together to learn the latest scientific developments of vaccines and technology that foster better immunization. So it helps people to network and learn from what other successful practices are doing to improve the immunization coverage rates of their practice. So I think this is a great forum to learn and get educated so that you can go back home and implement those good policies.
I was, just a mom, and I took my 10-day-old baby with me one day to his brother's preschool to drop his brother off, and found out the next day that he had been exposed to chickenpox. And that was the first time it occurred to me that people would not vaccinate their children because he was exposed by a purposely unvaccinated child. And so as more outbreaks happened around me, I really wanted to try to do something to help people not be afraid of vaccines. And so that's really where my advocacy stemmed from.
What exactly is vaccine hesitancy?
Vaccine hesitancy is any reason why someone might be afraid or hesitant to vaccinate their child. So a person who is convinced that vaccines are terrible, or a person who just worries about side effects. Anywhere in there, it's sort of a broad spectrum.
And what are some ways that we can resolve this issue and reach these vaccine hesitant parents?
I really think that, as I said in my speech, that having parents communicate with other parents about the value of vaccines is very good. And recent research shows that educating parents about the diseases we vaccinate against is also very important.
What type of risk is there for parents that don't vaccinate their children?
Well, of course, the risk is always that your children can get sick. And the diseases we vaccinate against them because they're dangerous, because they can cause disability or death or just general suffering. Having a child in a hospital is an awful thing to do. And so we prevent diseases because they're bad, and leaving your child at risk means that they're not protected against those bad diseases.
And what types of resources are available for parents or providers that want to continue this conversation?
Well, I like Voices for Vaccines at voicesforvaccines.org. The AAP also has some really wonderful resources for parents, and the CDC as well. And there's just every day there's new websites popping up. The important thing is just to make sure that they are run by people who have an expertise in vaccines.
What are some ways that we can increase Louisiana's rates?
Well, by making sure that your child gets their regular checkups, because at the regular checkup visits, we can also discuss immunizations. It would be a great opportunity for parents to talk to their physicians about the benefits and also the risks of being vaccinated and not vaccinated.
The important is to get immunized on a timely basis, and every child should be vaccinated by 24 months of age with 4 DTPs, 3 polios, and at least 1 MMR.
I think it's very important that parents and providers really work together to get children vaccinated. It really is, I would say, one of the single most important things that we can do for children's health.
Come out and see us and learn about vaccines. Thank you.